Exhibit number V30, Radiologic Technologist Safety, Navigating Infection Precautions in the Workplace. The objectives of the Clean Technologist is responsible for handling equipment and preventing contamination. Their key duties include equipment preparation, ensuring the X-ray machine, cassettes, and protective barriers are set up and ready before the procedure, maintaining aseptic technique, avoiding direct contact with the patient, bed, or any contaminated surfaces, image processing, handling the digital imaging system or film cassettes without contaminating clean areas, providing supplies, passing clean supplies, positioning aids, or protective covers to the dirty technologist as needed. Machine operation, adjusting settings on the X-ray console, ensuring proper technique factors without contamination, avoiding patient contact, ensuring they do not touch the patient or surrounding contaminated areas, transporting images. If using traditional film, transporting the cassette for processing without contamination, cleaning equipment post-procedure, wiping down non-contaminated surfaces, and ensuring a clean work environment for the next procedure. The dirty technologist interacts directly with the patient and contaminated surfaces, ensuring proper patient positioning and exposure. Their responsibilities include patient handling, positioning the patient properly for the X-ray while minimizing movement and discomfort, placing protective shields, correctly positioning lead aprons and shields to protect the patient and staff from unnecessary radiation exposure. Handling contaminated equipment, positioning the X-ray cassette behind or under the patient without contaminating the clean technologist. Ensuring proper alignment, assisting in aligning the central ray and anatomical area of interest without disrupting the sterile field. Minimizing infection spread, wearing appropriate personal protective equipment and following strict infection control protocols. Transferring cassettes safely, passing the contaminated cassette to the clean technologist without touching non-contaminated areas. Disposing of contaminated items, properly disposing of gloves, gowns, and other PPE according to hospital protocols. Cleaning after the procedure, disinfecting all contaminated surfaces before leaving the patient's room. Putting on personal protective equipment. Perform hand hygiene. Wash hands with soap and water for at least 20 seconds or use an alcohol-based sanitizer. Ensure hands are completely dry before proceeding. Put on a gown. Fully cover your torso from neck to knees, arms to wrists. Secure the gown at the back of the neck and waist. Put on a mask or respirator, surgical mask, secure over nose and mouth. Tie the straps or loop over ears and pinch the nose piece for a snug fit. Put on eye protection, goggles or face shield. Ensure a secure fit over eyes or face. Put on gloves. Extend gloves over the cuffs of the gown for complete coverage. Ensure a snug fit and check for any tears. Protection of equipment. Correctly mark the image receptor. The dirty tech holds the cover for the image receptor. The clean tech drops the image receptor into the cover. The dirty tech handles image receptor from this point on. Entering the patient's room. Knock and introduce yourself to the patient. Ask any guest to step out of the room. Confirm patient last name and date of birth. Clear room of any surrounding objects. The clean tech will manipulate portable and align CR with the IR.
X-ray, we're here to take a picture of your chest.
Would you mind stepping out of the room for radiation purposes? Taking the X-ray. Dirty tech will sit patient upright and remove any tubes or lines out of the field of view. Dirty tech will place image receptor with cover behind the patient. They will give brief exam instructions to the patient. They will give breathing instructions to the patient. The clean tech will expose on the patient's inspiration.
Want you to take a big breath in, blow it out, big breath in again, and hold.
Leaving the patient's room. Both techs may ensure correct patient anatomy is demonstrated. The dirty tech will remove the image receptor from behind the patient. The dirty tech will return the patient's belongings, tubes, and lines to previous placement. Dirty tech will help patient return to desired position. Dirty tech will give patient call light, then allow any guests to return to the room. Removal of PPE. Remove gloves, which are the most contaminated. Grab the outside of one glove with the opposite gloved hand, peel it inside out, and hold it in the remaining gloved hand. Slide bare fingers under the wrist of the remaining glove and peel it inside out, enclosing the first glove inside. Dispose of the gloves properly. Remove gown. Untie the gown at the waist and neck. Pull it away from your body, rolling it inside out. Dispose of it properly. Perform hand hygiene. Clean hands with soap and water or hand sanitizer. Remove eye protection. Handle only by the headband or earpieces. Dispose or disinfect if reusable. Remove mask or respirator. Avoid touching the front. Remove using the ear loops, ties, or straps. Dispose of the mask properly or store a reusable respirator in a clean area. Perform hand hygiene again. Clean hands thoroughly to remove any contamination. Instances when clean and dirty tech is used. Infection control precautions: tuberculosis, measles, a respiratory infection, MRSA, and C. diff. Emergency situations or high-risk environments: in emergency departments, burn units, ICU, or during procedures where patients may have a highly contagious condition. Preventing cross-contamination: in large hospitals with multiple patient areas or units where both infected and non-infected patients are treated. In conclusion, this demonstration highlights the differences between a clean and dirty technologist role when performing a portable X-ray under infection precautions. The clean technologist follows strict protocols to minimize contamination, ensuring proper handling of equipment, and maintaining a sterile field to protect both the patient and healthcare team. On the other hand, the dirty technologist, who is responsible for handling contaminated items and directly interacting with the patient, follows strict personal protective equipment protocols to prevent cross-contamination. By working together efficiently, both technologists play a vital role in reducing the risk of infection transmission while ensuring the patient receives the necessary imaging care. This approach is essential in maintaining safety and infection control in the healthcare setting.